Hi, it's Peter Wright and Kathleen Beauvais with another episode of Health Declassified, the weekly wrap up for the week ending 5th of September 2025. And Kathleen's going to kick the ball off with a fairly crappy subject to talk about today. I know that sounds awful, but it's really important and it's stopping a lot of people enjoying life, isn't it, Kathleen? So why don't you go straight into it?
Well, you're absolutely right, Peter. And what I want to talk to you is actually a very serious topic, and that is chronic constipation, Peter. And really, it deserves more serious attention. It really does. And this is an article from Dr. Mercola's site, which we will provide a link to below this video. But here are some of the highlights to that article, Peter. As we know, constipation is widespread, yet medicine is often at a loss as to what to do. In fact, 14% of American adults have constipation with no known cause. Because of this, treatments vary widely, and 62% of constipated patients are sadly too embarrassed to discuss the topic with their doctors. So the medical system often makes it worse, and nearly half of patients end up getting colonoscopies that they don't really need, and many become hooked on laxatives that damage their gut function over time, creating a vicious cycle where you need more just to be able to go. So it's not just uncomfortable. It's actually dangerous, if you can believe that, Peter. Chronic constipation disrupts your gut bacteria. It leaves you exhausted and significantly raises your risk for numerous severe diseases, in fact, and sends nearly 100,000 Americans to the hospital every year. So,
Wow.
what are the effects of constipation? So listen to this. Constipation frequently results in significant issues, dysbiosis within the gut microbiome. So what do we mean by dysbiosis? This is just the different bacteria that reside in your gut become
Hmm.
imbalanced, basically. So in many cases, the gut dysbiosis that leads to constipation results from food not being fully digested. Other issues include, as I said, fatigue, headaches, abdominal pain, nausea, and even vomiting, Peter. Chronic constipation is linked to progressively more severe illnesses, including diverticulitis, kidney disease,
Hmm.
gastric and colorectal cancers, ischemic colitis, and believe it or not, Peter, even Parkinson's disease. So, what do people
Is
tend
that
to?
right?
Yeah,
Wow.
absolutely. So, what do people tend to do when they're constipated? They turn to laxatives, of course. And while laxatives are relatively benign if used occasionally, over time they can impair the normal function of the GI tract and create a situation where one requires chronic laxative use. And that's a bad thing. So, the conventional causes of constipation, there could be a tumor, not to scare anyone, but I mean, that is a possibility where the
Hmm.
tumor grows in the colon. It progressively blocks transit through the colon, which in turn leads to the feces becoming narrower and narrower, along with abnormal weight loss, anemia, and rectal bleeding, and other diseases that can frequently cause constipation include hypothyroidism, hyperparathyroidism, anxiety or depression, the use of opiate drugs and other medications. And of course, there's dietary causes, such in particular, they say here, dairy consumption, fried foods, and alcohol. So that's my bit here about chronic constipation. So if that is you, get checked out, find out what's going on because it's not something that, we often tend to think, well, this is just our bodies and to just let it go, but don't, really don't.
So, how does one define when when somebody is constipated? Because people bodies are all different. So some people might go daily, some more than daily, some every 2 or 3 days. What's the norm? Have you any idea what the norm is?
Peter, you should be going every single day. You really should. Optimally, you should be going at least once or twice a day. And if you're not doing that, then you are ranging in the realm of chronic constipation. And that's just, yeah, that's how they define it.
Okay, so daily. Oh dear. I'm not going to go further on that one because anyway,
Okay.
well, that is interesting and it's serious. It's really serious.
It is, Peter, and unfortunately, so many people dismiss it because they just think, well, my body just doesn't go every day, so what? And they think of it as normal. That's just part of who they are and how their bodies work. But in fact, it isn't. There could be an underlying cause because that shouldn't be. If you're eating
Mm.
regularly, you should be going regularly.
Regular. I'm not going into my history because I'm
All
anything
right,
but
Peter.
regular.
All right.
Okay, so that is an interesting one, and I know from I know of people that have developed diverticulitis from
I have
having
as
chronic
well.
constipation for years, and that's not a very pleasant condition to have. I know. Okay, so I picked up two quick health ones this week,
Mhm.
and the one is quite alarming, and that is that recent investigations have established a link that says Tylenol or paracetamol, as it's called in Europe and certainly where I came from in Southern Africa, pregnant mothers using Tylenol or paracetamol or acetaminophen during pregnancy may increase the chances of their unborn child developing autism or ADHD. So the trials that they've done have statistically significant number of these conditions in newborn children. It's not wide enough yet to be alarming, but as the researcher said, this requires further investigation because they they've found a link and they're concerned about it. So that was the one that I picked up, and that was on Epoch Health. The other one is a really interesting one, and it was discovered by total accident. A Dr. Bernardi in Italy was investigating the effect on different types of music on people's stress levels and general mental health. So he tried reggae, slow classical, fast classical, rock, and something else. There was five different types of music. And as a control, between each type of music, there was a 2 minute complete silence, right? There was no noise whatsoever. And then he interpreted the results. And this has been backed up by another researcher in a totally different study, found the same thing. What they found was that people's blood pressure was lowest during those periods of complete silence, lower than any of the different types of music, right?
Oh,
It stands to reason that classical music seemed to have a better effect on calming people down than slow classical than fast classical rock and the others. They also found that there was quite a significant difference in cognitive, what do they call it? If you're doing something highly cognitive tasks, right, you will suffer less stress if you're in complete silence than if you have even slow classical music playing in the background.
is that right?
Isn't
Well,
that?
that's an interesting
Yeah,
one because
yeah,
I have heard of a study that was done, in fact, with animals, in fact, on dairy farms, where they played
yep,
classical music, specifically classical music for cows, and they produced more milk than those
yep.
cows that were not exposed to classical music. So that's kind of
That's right.
interesting. Hmm.
Yeah, very interesting. And then there was another one, and I unfortunately I can't find the link right at the moment, but it struck me talking about tetanus vaccine and the dangers of tetanus vaccination. And most doctors say, especially people like me who work with horses and farming and have our hands in the soil, that you should have a booster every 10 years. And they said in America, in recent history, there have only been 30 cases of tetanus a year in the whole of America with a population of over 300 million, which means you've only got a 1 in 10 million chance, right? And most people are not exposed to it as much as farmers. And they also found that you get no more immunity by having that 10-year booster than if you go 30 years without a booster. Isn't that interesting?
Wow. Yeah, that is
No,
interesting.
I'm not saying people shouldn't get tetanus shots, but
Sure.
I just reporting what I read, and I found that interesting because I've been getting them living on a farm every 10 years, and it sounds like it's not necessary. Anyway, that's enough. There's so many interesting stories coming out on health topics lately that it's hard to keep track.
Mhm.
Kathleen, you want to talk about your health products? Why don't you go for that?
Oh, yes, Peter. I have to talk to you about these products from Partner Co. I absolutely love these drops, Peter. These are herbal drops, and in the United States, they have homeopathic versions. These are fantastic. So, really, losing weight isn't just about what you eat and how much you exercise. It's really about your hormones, your stress levels, your digestive health, and metabolism too. So, people who are wanting to lose weight, these drops have been incredibly effective, absolutely effective. And for those who are not really looking for weight loss, but looking to help balance their hormones, reduce their cortisol levels and their stress levels, these drops have been absolutely phenomenal. This, in combination with another product from Partner Co. called Abvantage, these come in a form of a supplement. This product can help boost your metabolism, reduce body weight, and help you burn calories at an absolutely incredible rate, 10 times faster than normal, Peter.
Oh,
So
yeah.
this, in conjunction with these drops, are really transformative for many, many people that are using them right now. And we will provide links to these products below this video. So that's it for me.
Great.
Yeah.
I've got to ask,
Yeah.
considering what we've been talking about, do they help with constipation?
Well, it really does help to keep you it's a cleanse, really. It's helping to detoxify, and when you detoxify, you go, Peter.
That's right. And if it's increasing your rate of metabolism, surely that must be beneficial for movement of stuff, food through your gut, right?
Right?
Yeah. Okay. Thanks for that, Kathleen. So let's talk about what's happened on Health Declassified this week.
Mhm.
And we had this week on Tuesday, we published an episode with Dr. Jeff Gross, who is a stem cell therapy
Oh,
expert.
yeah.
And wow, this was an interesting one. He's a regenerative medicine expert as well. And he's done a lot of work on regenerating cartilage in damaged knee and hip joints. And he told us a few of the examples that he's had, and one that stuck in my mind was a woman. I think she was 58, and she'd injured her knee and badly in a skiing accident,
Mhm.
and her regular doctors and surgeons had said she'd got to have a knee replacement, and she didn't want that, so she came to see Dr. Jeff Gross, and he put her on this stem cell therapy, and it regenerated her knee cartilage. And he showed us on the episode, you can see pictures of how well the cartilage has grown back, and she is able to have full mobility without having a knee replacement. So that is incredible, right?
Isn't that
So that's a good
incredible?
one.
It is absolutely, especially for those in Canada that are
Yeah,
waiting 2 and 3 years for this type of surgery. It may not
sure,
even, it
sure.
may or may not be necessary, but if you visited Dr.
Yeah,
Jeff Gross to find out, maybe there's a way to regenerate your own cartilage and not even need the surgery.
absolutely.
That's phenomenal.
Yeah. It is. He has a lot of information on his website. There'll be a link in the description where you can have a look at that.
Mhm.
So we had another doctor. Well, we will have another doctor in 2 weeks' time. That's Dr. Lloyd Globerman, and he is a lifestyle expert, and he's developed an app that helps you move properly, eat better, sleep better, and just generally live a healthier life. And his app, he was telling us all about it, is makes it much easier when you've got a busy life, and it makes it much easier to keep track of what you're doing and what you should be doing. So that's a good one. 2 weeks after that will be not a doctor, sorry, Deborah Kadagian, who's a psychotherapist, and she is also a psychedelic psychotherapy expert, and she talks about psychedelic psychotherapy. She's an artist as well, and she is the wife of DJ Kadagian, who was on the show a year ago, I think it was, and he talks about near-death experiences.
Yeah.
So it's a very interesting family. So that's a good episode. And then rounding off after that, the next one after that will be Rabbi Daniel Cohen talking about living a life of legacy. And again, it's quite different to the strict medical ones we've done, but very important on living your life using all your mental and physical faculties and leaving a legacy. So that's our lineup of guests that are coming up for you over the next few weeks. And then, of course, we always have a featured author. And this week's, so we're going to just mention my book again, 5 Steps to Thriving on Adversity, which contains some stories of my very interesting life in Africa and some of the lessons I've drawn from it that's enabled me to keep going through some fairly serious stuff during the course of my life. So that's the wrap up from me. Kathleen, back to you.
Oh, thank you, Peter. And I just want to give a plug for your book as well. I've read it cover to cover, and let me tell you, folks, it is one book that really should be made into a movie because it is that extraordinary. I can't believe that these events actually happen to you, Peter. Really, it's just phenomenal. So just a little plug for your book because I think everybody should read it.
Well, thank you for that, Kathleen. Yeah, that's great. Good.
Well, that's it from us. Until next week, take care, everyone. Bye-bye.